Hi, I'm Peter Pronovost, the Johns Hopkins Medicine Senior Vice President for Patient Safety and Quality and the Director of the Armstrong Institute. One of the most important ways you can keep yourself safe in caring for patients with Ebola is to make sure that you learn to put on and take off personal protective equipment in the most appropriate way. Now, the Centers for Disease Control has provided us detailed guidance for how to do that, but we needed training modules. So we partnered with the CDC to do that. We pulled together our infectious disease experts, human factors and systems engineers, psychologists, instructional designers, and technology experts to come together to produce this content. We've been here a week working long hours to make modules for you. And now what you will see are 3 key modules. Number 1, how to put on or don personal protective equipment. Number 2, how to take off or doff personal protective equipment. And number 3, how the observer can work together to help ensure your safety using teamwork behaviors that were developed by the Agency for Healthcare Research and Quality. Now, we know these are anxiety-filled times. Believe me, I'm a critical care physician. I'm right with you. But we also know that with proper training and when we ensure your competency in putting on and taking off this equipment, we could safely care for these patients. So we hope you enjoy the training, and from our colleagues at the Centers for Disease Control and our colleagues at Johns Hopkins Medicine, we thank you for all you do for patients.
This donning procedure assumes the facility has elected to use an N95 respirator with a gown. An established protocol facilitates training and compliance. Use a trained observer to verify successful compliance with the protocol. The trained observer will read aloud to the healthcare worker each step in the donning procedural checklist and visually confirm and document that the step has been completed correctly. The trained observer in the donning process is a dedicated individual with the sole responsibility of ensuring adherence to the entire donning procedure. The donning process is conducted under the guidance and supervision of a trained observer, who confirms visually that all personal protective equipment is serviceable and has been donned successfully. The trained observer should suggest to the healthcare worker that he or she attend to personal needs, such as using the restroom and hydration prior to donning personal protective equipment. The trained observer uses verbal commands and a written checklist to confirm each step in donning personal protective equipment and can assist with ensuring and verifying the integrity of the ensemble. No exposed skin or hair should be visible at the conclusion of the donning process.
We're now going to work together carefully to put on your personal protective equipment. I'm going to be here with you. I'm going to help you and guide you. We're going to do everything slowly and methodically. If you have any issues or questions, just stop and feel free to ask me whatever you need to. I'm going to give you verbal instructions and you're going to acknowledge them back to me.
Before starting the donning procedure, change into clean surgical scrubs or provided disposable garments and dedicated washable footwear, such as plastic or rubber materials, in a suitable, clean area. All footwear should be closed toe and closed heel with no holes. No personal items such as jewelry, watches, cell phones, pagers, or pens should be brought into the patient room. Ensure hair is pulled back, away from the face, and off the neck and back. Ensure that your nails are no longer than 1/4 of an inch so they do not puncture the gloves.
Now we're going to look at your PPE to make sure that everything is here and intact.
Visually inspect the personal protective equipment ensemble to be worn to ensure that it is in serviceable condition and that all required personal protective equipment and supplies are available and that the sizes selected are correct for the healthcare provider. The trained observer reviews the donning sequence with the healthcare worker before the healthcare worker begins the donning process and reads it to the healthcare worker in a step-by-step fashion using a checklist.
First, before any procedure, we need to perform proper hand hygiene. Make sure that you get in between your fingers, the backs of your hands, and your wrist. Now we're going to put on your boot covers. For safety, go ahead and sit in the chair and take your time.
Make sure that all areas of the foot are covered and the boot covers are snug over your ankle and calf. If your boot covers have a strap, wrap the strap around for a comfortable fit. Try not to touch the floor or other areas with your hands while putting the boot covers on. If you do, disinfect your hands before putting your inner gloves on.
Now we're going to put on our first pair of gloves. Do this as you normally would. It does not need to be done in a sterile fashion. Make sure that the cuffs of the gloves go as far up your arm as possible. These are going to be called your inner gloves. Now I'm going to want you to put on your gown. Go ahead and look at it to make sure there are no holes or tears. Take your time. Put the gown on slowly and methodically.
Ensure the gown is sized properly and large enough to allow unrestricted freedom of movement. If available, a gown with thumb hooks helps to secure the cuff of the gown over the inner glove to help ensure there is not a gap between the glove and the cuff. Tie the gown securely, but in a manner that it can be easily untied when you begin the doffing process. Leave some length of the tie so that it can be pulled and untied without much effort. Ensure cuffs of the inner gloves are tucked under the sleeve of the gown.
We're going to tie the gown on the side, carefully. Snug, but not too tight.
If your gown does not have thumb hooks, some facilities may consider taping the sleeve of the gown over the inner glove to prevent potential skin exposure from separation between the sleeve and inner glove during activity. If taping is used, a tab should be created by folding the tape over at the end. This tab will help facilitate easy removal during the doffing process. Care must be taken to remove tape gently. Experience from some facilities suggests that taping may increase risk by making the doffing process more difficult.
Now we're going to go ahead and put on the N95 respirator.
Hold the respirator in the palm of your hand with the straps facing the floor. Place the N95 respirator on your face, covering your nose and mouth. Pull the bottom strap up and over the top of your head, and put it behind your head below your ears. Take the upper strap and put it behind your head towards the crown of your head. Mold the nose piece of the respirator over the bridge of your nose to obtain a tight seal. Always follow the manufacturer's instructions for wearing a respirator. Perform a fit check to ensure there is a good seal against the skin.
Now you're going to put on your surgical hood. First, you need to inspect it. You're going to put on the surgical hood so that the opening is in the front. Slowly pull the hood over your head and your shoulders.
The trained observer should give a check once the hood is in place to ensure that all parts of the skin are covered, no hair is hanging down, and the hood extends to the shoulders. If the patient is vomiting or has diarrhea, put on a single-use, fluid-resistant or impermeable apron that covers the torso to the level of the mid-calf. The apron provides an additional layer of protection to the front of the body against exposure to body fluids or excrement from the patient.
Now you're going to put on your outer gloves. If you need help with this, just let me know.
Double gloving provides an extra layer of safety during direct patient care and during the personal protective equipment removal process.
When putting on these gloves, make sure that the cuffs extend as far up your arm as possible and are over the cuff of your gown.
Some facilities have found that using different colored gloves for the outer gloves is beneficial. Utilizing different colored gloves for each layer helps to rapidly identify any breaches in glove integrity.
Next, you're going to put on your face shield. Do this by placing the elastic strap behind your head, making sure that the foam is resting on your forehead.
Put on a full face shield over the N95 respirator and surgical hood to provide additional protection to the front and sides of the face, including skin and eyes. Bending forward, hold on to the face shield with both hands. Expand the elastic with your thumbs and place the elastic behind your head so that the foam rests on your forehead. Once the shield is situated, Check to make sure it covers the front and sides of the face and no areas are left uncovered.
Can you please hold your arms out to your side and turn around for me? I'm going to check to make sure that all of your skin is covered and you are able to move comfortably.
The healthcare worker should be comfortable and able to extend the arms, bend at the waist, and go through a range of motions to ensure there is sufficient range of movement while all areas of the body remain covered. A mirror in the room can be useful for the healthcare worker while donning personal protective equipment.
Okay, everything looks great.
Your trained observer will help you with the process. Before you move from the patient's room and into the doffing area, you will need to take a few minutes to do some important things. First, get the attention of the trained observer. Once he or she signals to you that it's clear, enter the doffing area. Inspect your personal protective equipment. Are there any obvious signs of contamination or materials on it? If so, you will need to disinfect the surface of the personal protective equipment with an EPA-designated disinfectant wipe. Last, disinfect your gloves, also with an EPA-designated disinfectant wipe or alcohol-based hand rub. You and your trained observer are a team throughout the doffing process.
I'm here to help you through the doffing process. You'll hear me give directions that are not part of standard practice, but are designed to keep you safe.
The trained observer will read each step aloud, giving you the time to take the required action.
We need to check for any rips, tears, or contaminants on your clothes.
Remember, don't rush through the doffing process. Take your time and be careful.
Now I'd like you to disinfect your outer gloves.
If you're using an apron, you now need to remove it. The assistant will assess the type of apron used and will assist with untying the strap. Then, you will remove the apron by breaking the strap or lifting the strap over your head, rolling from the inside to outside and away from your body, and discarding it in the appropriate receptacle. If the apron can be gently pulled away from the body by tearing it at the neck, this process should be used. Once the apron is off, inspect your personal protective equipment for visible contamination, cuts, or tears. If you see your personal protective equipment has been compromised, or if there are any signs of contamination, disinfect it with an EPA-registered disinfectant wipe.
Now I'd like you to disinfect your outer gloves.
In your doffing area, you will have 2 chairs. One will be where you sit to take off your boot covers only. This chair will be marked clearly as dirty. Once you sit down, be careful not to touch one leg with the other. Then, grasp the outside of the boot cover and pull down toward your ankle. Then, lift the boot cover over your heel, pull it off your foot, and dispose of it correctly. The exact way to remove the boot covers will vary based on the manufacturer's instructions.
Okay, great. Now it's time to disinfect your outer gloves again. In the next step, you're going to remove your outer gloves. Please do this slowly and carefully to avoid contaminating or tearing your inner gloves. You're doing great.
There are two very important things to remember. First, pay special attention so that you don't contaminate or tear the inner glove. Second, don't snap the gloves, which could cause spray. Hold one of your wrists so that your thumb points to the ceiling. Pinch that glove and lift at the wrist. Then, roll it down until the glove is completely off your hand in a ball in the palm of the other hand. Then, slide a finger down and inside the outer glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves.
Good job. Now inspect both sides of your inner gloves for visible tears or contamination.
If you do see a tear, hole, or signs of contamination of the inner gloves, disinfect with EPA-registered disinfectant wipes or alcohol-based hand rub. Then, remove the inner gloves, making sure not to contaminate your bare hands. Once the gloves are off, perform hand hygiene with alcohol-based hand rub on your hands. Then, put on a new set of gloves up to the edge of the sleeve.
Okay, great. Now disinfect your gloves.
In this step, you will take off your face shield. To do this, tilt your head forward slightly. Grab the strap at the temples and pull it forward and over your head, which will let the face shield fall from your face. Dispose of the face shield.
Okay, great. Now disinfect your gloves. Next, slowly remove the hood.
To do this, tilt your head slightly, grasp at the crown of the head, and use one hand to pull the hood forward, away from the body, and off the head. Dispose of it.
Okay, great. Now disinfect your gloves. Okay, go ahead and remove your gown.
First, release the tie. Then grasp the gown at the hip area and pull the gown down and away from the sides of your body. Once the gown is off your shoulders, pull one arm at a time from the sleeves of the gown. Arms are bunched at your wrists. Then, roll the exposed side of the gown inward until it's a tight ball. Dispose of it. Now it's time to remove the inner gloves. Like with the outer gloves, there are two very important things to remember. First, pay special attention so that you don't contaminate your hands. Second, don't snap the gloves, which could cause spray. In this step, you'll need to first disinfect your gloves, using the same product as in previous stages. The process to remove the inner gloves is the same as it was with the outer gloves. Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then, roll it down until the glove is completely off and a ball in the palm of the other hand. Then slide a finger down and inside the glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves. It's important that you don't touch your face or any other exposed skin with your bare hands now. Perform hand hygiene using alcohol-based hand rub only. Then put on a fresh pair of gloves and you're ready for the next step.
Now you're going to remove your respirator.
It's important that you not touch the front of the respirator. First, tilt your head forward. Then use two hands to grab the bottom strap. Pull to the sides, then over your head. Next, use both hands to grab the upper strap. Pull to the sides, then over your head. Keep tension on the upper strap as you remove it, which will let the mask fall forward. Dispose of it.
We're getting near the end. You're doing great. Now disinfect your gloves. Please have a seat in the clean chair so that you can disinfect your shoes.
To disinfect your shoes, sit down in the clean chair. This will be designated as the clean chair. Once you're sitting down, use the EPA registered disinfectant wipes to thoroughly disinfect all the surfaces of your shoes, moving from top to bottom and including the soles. Be sure not to touch your ankles.
Now disinfect your gloves. Now we're going to remove your inner gloves. Be careful to do this slowly to avoid tearing the gloves or contaminating your hands.
Once your gloves are off, it's very important that you don't touch your face, any exposed skin, or any surface in the room.
Go ahead and perform hand hygiene. Okay, one more important step. We need to check for any rips, tears, or contaminants on your clothes.
Congratulations, you've now successfully finished the doffing process, so you can leave the doffing area. You need to find the closest designated shower where you can remove your scrubs and bathe with soap and water. A shower is recommended at the end of each shift for the comfort of the healthcare worker.